Hello, my name is Lore Van Espen. I'm a PhD researcher at the Laboratory of Viral Metagenomics at the KU Leuven in Belgium.
Hello, my name is Marco Coragnac and I'm the president of European Liver Patient Association. I just wanted to say, Lore, thank you very much for your work. You know, every little small thing that the PhD students does just bring us closer to helping patients.
Yeah.
So what did you do?
So we actually studied the gut virome, which is a viral part of your gut microbiome. And most people think about bacteria when they hear the microbiome, but we actually study the viruses in your gut. And most of these viruses actually don't infect the human host, but rather they infect the bacteria that live inside our gut.
But you worked with ACLF patients? What exactly is ACLF?
So ACLF is a severe complication of chronic liver disease with a high short-term mortality.
So you compare the ACLF with something?
Yes, so we compared patients with ACLF to patients with decompensated liver cirrhosis, but without ACLF.
What does it mean to have a decompensation? What is that?
So decompensation is when your liver is so severely damaged that it can no longer compensate for the functions it should normally do.
Very interesting. And what did you find out?
So we found out that there are some alterations in the viruses that live in the gut of these patients. We saw that there's a higher diversity of viruses. We also saw a shift in terms of how these viruses infect their bacterial hosts. And we found some specific phages that were associated with the development of ACLF, the presence of bacterial infection, and those are also associated with higher levels of mortality.
So, and you foresee some benefits for the patients with or without ACLF or?
Yeah, so firstly, this research will of course help or improve the understanding of the role of the gut virome in chronic liver disease, and hopefully eventually it will also contribute, or we can develop some clinical applications that maybe prevent ACLF or will allow us to intervene more early to follow up specific patients to prevent the progression of disease.
So preventing the progression means that it will be stopped or maybe they will be better, or does it affect also mortality?
Hopefully, if we can intervene or prevent this progression, it will also reduce the mortality of the patient. Firstly, we want to improve our understanding of these alterations in chronic liver disease, what causes them or how they interact with the human host, and also with the gut bacteria. And then finally, or eventually, we could also try to develop some clinical applications that will benefit the patients.
Thank you very much, Laura.